Each year, Americans spend $50 billion on back-related issues. It is the second most common reason for doctor visits. It is estimated that 80% of the population will develop low back pain in their lifetime. Low back pain can be caused from a variety of factors. It is usually a result of several factors, including any one or more of the following: poor posture, being overweight, lack of physical activity, poor flexibility, decreased strength, poor sleeping position, stress or acute trauma. In fewer cases, it can be caused by more serious conditions, such as a pinched nerve, neuropathy, spinal stenosis, osteoporosis, spondylitis, or sciatica. If, however, the pain stems from the first list given, musculoskeletal dysfunction, then establishing a balance between the agonist and antagonist muscle should be our primary focus. Stretching the hip flexors, the piriformis, and the rectus femoris, while strengthening the hip extensors, such as the glutes and the hamstrings, would be a good place to begin. Once you have a diagnosis and a clearance from your doctor, you may want to enlist the help of your personal trainer to safely progress you through a three-level back strengthening program. So I'm going to demonstrate 3 different exercises out of the three different levels of the back strengthening program. So level 1, the first exercise I'll show you is the supine pelvic tilt. Now what's important after we've had back issues, back pain, back injury, it's important to establish a neutral spine. Get the core strength to establish and maintain a neutral spine. So the first exercise is a supine pelvic tilt. With this exercise, your objective is to get the pelvis tilted and the back pressed to the floor. That is all this exercise is. It is vitally important that we learn how to establish and maintain a pelvic tilt. So that is what this exercise looks like, supine pelvic tilt. The second exercise I'll demonstrate in level 1 is the prone opposite raise. Now remember, with your supine pelvic tilt that we just learned, it is important to establish that neutral spine through that pelvic tilt throughout all of your exercises. Get the arch out of the back, maintain that neutral spine. So tilt the pelvis, and what you're going to do now is look forward, establish a neutral neck as well, and lift opposing arm and leg. You're going to do this exercise slowly. Hold for 2 counts at each lift, maintaining that supine pelvic tilt. The third exercise I will show in level 1 is the supine hip extension. Again, establish your neutral spine with your pelvic tilt. Then you're going to lift the hips up onto the ceiling, lift them off of the floor. You're squeezing the glutes at the same time that you're lifting. Hold for 2 counts and lower. Establish that pelvic tilt, neutral spine, lift, hold, and lower. Supine hip extension. Do 3 exercises in level 2 program, the first one being the same exercise that we just demonstrated in level 1 with a progression. So this is the supine one-leg crossover hip extension. So establish that neutral spine again with that pelvic tilt. You'll lift on one leg. Maintain a level hip balance. Don't let the hips rock. Pull the abdominals in tight. Lift the hips. Hold for 2 and lower. Pelvic tilt, belly button to the spine. Lift the hips. Hold for 2 and lower. Okay. The next exercise in level 2 is the kneeling bird dog. On all fours, you will do the same exercise as we did in level 1, but now you're on all fours. So that you will establish that pelvic tilt, the neutral spine. You're going to lift one leg and arm at the same time. Looking forward, holding for 2, back down. Opposite, lift and hold for 2, and back. All the while maintaining that pelvic tilt and neutral spine. The third exercise in level 2, back strengthening program, is good mornings. With good mornings, what your objective is to establish that neutral spine, that pelvic tilt, keep the core engaged, but you're not rounding the back. This is practicing bending over, weight is fine, bending over with no rounding of the back. It's a very simple movement. However, as we know, if we've had low back pain, it can be a painful movement. This does strengthen and help us improve. Good mornings are just a bend over, not bending back. Essentially a hip hinge. Okay, we are on to level 3 exercises. This is taking that hip extension to a higher level. And again, with back pain, this is a challenging exercise. We do want to progress properly to this. Essentially, this is the hip extension with your feet on the ball. Same as before, we'll establish that neutral spine, pelvic tilt, belly button, and core engaged. You're going to lift the hips while your feet are on the ball. Hold for 2 and drop it slowly. Engage that core, pelvic tilt, neutral spine. Lift, hold for 2, and drop it slowly. Exercise number 2 in the level 3 program. We're going to take the opposite raise to a higher level over the ball, establishing that pelvic tilt again. We can't emphasize that enough. And you're going to opposite raise. Hold for 2 and lower. Hold for 2 and lower. Make sure your core is engaged. Final exercise we'll demonstrate is the stretch, roll, and reach on the ball. Sounds fun, doesn't it? Okay, so we are lying supine on the ball, hands up. Now remember, what do we need to do here? Pelvic tilt, establish that core and that neutral spine. What you're going to do now is roll upward, reach down to the feet, and back down. Tilt, establish the core, reach, and stretch. One last word of advice. Rotational exercises should only be done after clearance and approval by your doctor or a physical therapist if you've had a problem or an injury. I'm Kippy, and that's your fitness tip of the week.